Good morning, everybody. You're all very welcome to Dublin Castle this morning. We're delighted so many friends have travelled from various parts of the world to be here for the second GETHealth Summit. At the beginning, I'd really like to thank our sponsors, Qualcomm, Novartis, NIH, Fogarty Institute, OAR, Johnson & Johnson, and all the others who've supported in making this event possible. I'd like to thank Enterprise Ireland, who've been hugely supportive in allowing us to have this event. And I'd also like to thank, and particularly, I'd like to thank the Department of Health, who facilitated access to the OPW to this wonderful location for the conference here at Dublin Castle. I'd like to make apologies for Julie Cinnamon from Enterprise Ireland, who couldn't unfortunately be here, but I know Aisling King and other colleagues will be here over the next few days. I'd particularly delighted to welcome Bob Bollinger, whose inspiration it was to have the first GETHealth Summit in the UN in New York last year, which we all know was a hugely successful event. I think for the first time this event brought together the very best of evidence of how we can really revolutionize the training of health workers globally using both mobile technology and new e-learning platforms. So I call on Bob to say a few words.
Thanks, Tom. Thanks, Tom, and welcome again. I'd also like to add my thanks to the Government of Ireland and to IHEAT for hosting us in the second GETHealth Summit, and welcome all the delegates. Many of you who were with us at the UN last time, and many of you who are new, we welcome you as well. I just wanted to reiterate our mission and our objective, our shared objective for the GETHealth Summit, and it's really to address the health workforce gap that Tom talked about and that we're all well aware of, but particularly to find unique ways to leverage the power and the disruptive force of information technology and all that that entails. It's certainly been a transformative force in other parts of our lives, and we have an opportunity, I think, as we all would understand, to transform healthcare globally, in particular through the support of health worker training and service delivery. And so one of the themes that we try to continue and emphasize throughout the GETHealth Summit is that it takes an entire ecosystem, which is really, I give credit to my friend Reza Jafari, one of our co-organizers, with emphasizing that we really need to engage all aspects of the ecosystem, public, private, and everything in between, to have a successful, scalable, and sustainable solution. And so we look forward to the deliberations and your contribution over the next 2 days, and thank you very much. And as you know, this is a very interactive format, so we welcome your input from all the participants as well as the panelists. And thank you again to our hosts for welcoming us to lovely Dublin, and we look forward to a productive and successful 2 days. Thank you very much.
Thank you, Bob. Bob described it as lovely Dublin, but as we're all aware, this morning the weather conditions are pretty ferocious, and I don't know if any of you saw Angela's Ashes, but one of the things in Ireland we criticised the movie about was it rained perpetually in every scene in the movie. So I'd just like to dispel that notion that it rains 365 days a year here. I was in Qatar recently, and obviously it doesn't rain there very much. I think it rains 2 days a year. And I was there for one of those 2 days. So there might be something in that. And I was back in Ireland, and I met a guy down the country, and he said to me, I had a family came from Qatar, and they rented our country house. And the gardener was out in the garden, and he was on the ride-on lawnmower cutting the grass. So he's riding along on the ride-on lawnmower, and it started to rain, nice soft rain, as we call it in Ireland. And he got down off the ride-on lawnmower, and he went into the shed to get some cover. And at the same time, the whole family of Qataris ran out into the middle of the lawn like this. So what's rain for one person is manna from heaven for somebody else. So I'd like to welcome on your behalf, and we're very honoured to have him here, our new Minister for Health, Minister Varadkar. He is the youngest member of the government. He's already, at his tender young age, held several ministries. He is, I think, true to say, a true disruptor. He is very willing to challenge public sector reform. I believe he's a man of strong integrity, a very straight talker, and a good negotiator. I think he understands very clearly the issues we're talking about, because he himself trained as a family doctor and has a membership of the Irish College General Practitioners. Much like myself, actually, his dad was a GP as well, a family doctor, and well known within their community for his honesty, integrity and advocacy on behalf of his community as a primary care physician. So I think our Minister really understands very clearly all of the challenges we face in healthcare in terms of budgetary constraints, etc. But more importantly, that primary care, community care and the use of technology can really transform the way we deliver healthcare. So on your behalf, I'd like to welcome Minister Varadkar to address the conference.
Good morning, distinguished guests, ladies and gentlemen. It's my great pleasure to welcome you to this conference this morning. And I really want to offer to all our international guests, as we say in the Irish language, Céad Míle Fáilte, 100,000 welcomes. I think it was mentioned just there that I've held another brief before I was Health Minister, and that was the Minister for Transport, Tourism and Sport. And I still have a special love for tourism and sport. So I do hope that while you're here at this conference in Dublin, that you don't work too hard, and that you do have an opportunity to see our city, our ancient city, and even a chance to take a bit of a look around the country as well. You're here, as you know, in Dublin Castle, and Dublin Castle is a very interesting venue. Its parts of it date from the 12th century, and when the Normans came to conquer Ireland, having conquered northern France and Britain, they set up their castle here on the Black Pool in Dublin, and Dublin means Black Pool. It then became the centre of English power in Ireland for a very long time, and in many ways was a hated place, because it's where the secret police and others were based, and a lot of the records as well. But then was handed over to Michael Collins on behalf of the new Irish Free State in 1921. And since then it's become a very important state venue. Nearby you have St. Patrick's Hall, where our President gets inaugurated once every 7 years. A lot of official functions are held here, such as state dinners and important conferences, or conferences that the government regards to be important. It's also the headquarters of the Revenue Commissioners, our IRS, and it also has the Chester Beatty Library not too far away. And if you do get a chance to take a look around there, I think you'll really enjoy it. He was an Irish a patriot who travelled the world at a time when people didn't, and collected all sorts of knickknacks along the way, and it's turned into a really wonderful museum, and has a very nice cafe as well if you want to get out for lunch. It's a real privilege for Ireland to host this conference, and we're honoured to be joined today by ministers from Bangladesh, from Tanzania, the Philippines, Ethiopia and Uganda. Since this is a technology conference, it's appropriate that we have so many people taking part online, and I want to extend a very warm and wholehearted welcome to that virtual community. Delegates, we know that in many low-income countries, the rates of premature mortality and morbidity are truly shocking. In sub-Saharan Africa, as many as 1 in 7 children die before their 5th birthday, and the majority of child mortality is caused by readily preventable diseases like pneumonia, diarrhoea and malnutrition. Ireland's policy for international development, which is entitled One World, One Future, includes a commitment to improve access to essential health services. We know that a trained healthcare workforce to oversee and deliver quality services is critical to reach those people and communities most in need. The EU is Africa's most important international partner, and it's also the largest source of foreign direct investment in Africa, the largest donor to African development cooperation programs, and also Africa's largest trading partner. And that presents both enormous opportunities and enormous responsibilities for those of us in Europe. All countries face an ongoing challenge in terms of their health workforce, and this requires a concerted global response. The shortage of health workers is a global challenge, both for high-income and low-income countries. And the World Health Organization has estimated that we have a global shortage now of healthcare workers of about 4 million. And 1 million of that shortage is accounted for by Africa. And to make matters worse, there are fears that this worldwide shortage will double over the next 20 years. As you know, many developing countries have no medical schools, and even the more developed countries face healthcare worker shortages. In fact, one of the issues that I'm facing now as Ireland's Minister for Health is how to attract and retain certain types of healthcare professionals. Our own problems here in Ireland give me a good understanding of the scale of problems that must be facing developing countries in recruiting doctors and nurses and holding on to them. We also know that a shortage of healthcare workers in high-income countries is driving migration from low-income ones, the so-called brain drain. And to address this, the World Health Organization's Code of Practice and International Recruitment of Health Personnel was adopted at the World Health Assembly back in 2010. Ireland is very committed to that WHO code, and we've responded by increasing training posts for doctors and nurses in Ireland to self-sufficiency levels. We've also established a programme which uses non-consultant posts, which are not required for domestic training purposes, to provide overseas doctors with the kind of clinical experience that they might be able to get at home. In fact, the World Health Organization has also recently commended Ireland for its actions. While I'm proud to say that Ireland is doing its bit, I know that solving the worldwide shortage of healthcare workers is a longer-term goal. And even if we could solve these shortages tomorrow, both high and low-income countries would continue to face the challenges posed by demographic change, advances in medical science, increasing expectations, which all lead to spiralling healthcare costs. Most countries, including Ireland, face many challenges in delivering the kind of healthcare that populations expect over the next few decades. We recognise that current healthcare delivery models are not good enough to deliver on expectations. And developed countries like Ireland are turning more and more to new technologies, particularly information technology systems, to support delivery, something that can be incorporated directly into healthcare. And I think a good example of that in Ireland is our national stroke programme, which allows doctors in more remote hospitals to be advised using telemedicine on how to thrombolyse a stroke patient. And since we brought in that programme, we've increased thrombolysis rates to 11%, which are among the highest in the world. Last year, Ireland published an e-health strategy, and our e-health strategy uses the work of IHEED as a case study in good practice in terms of accelerating the training of millions of new healthcare workers needed to reach the billion people who still have no access to healthcare professionals. The work includes advocacy, convening global players within the sector, written evidence of best practice, and developing media and online programs. Perhaps the most exciting and most promising development in communications technology in recent years has been the dramatic growth of the mobile industry and the emergence of ever faster mobile devices. The growth of mobile technology in countries that do not have fixed line infrastructures offers real opportunities for healthcare. In 2011, WHO reported that the use of mobile and wireless technologies has the potential to transform health service delivery. One of the factors driving this potential is the continued growth in coverage of mobile cellular networks. Over 70% of them are in low and middle income countries, covering 85% of the world's population, extending far beyond the reach of the electrical grid. In many ways, developments in mobile technologies probably hold more promise for Africa than they do for developed countries like Ireland. And I'm delighted that Dennis O'Brien of GETHealth is going to address you on this topic a little bit later on. And for those of you who've travelled to Africa will know the extent to which mobile phone credit has become a currency, and the extent to which some developing countries can leapfrog old landline technologies and go straight to mobile. And I think there's some parallels for that in Ireland. In Ireland, general practice, primary care has embraced IT, but in our hospital systems, they're still very much paper-based. There's still people going around wheeling a trolley of charts behind them. And while in some ways that's a big problem, I think it's also an opportunity because it does allow us to skip a generation of technology by proper investment in secondary care IT, which is intended in the future. And indeed, in the next week or so, we'll be appointing a new Chief Information Officer for the Health Service, whose job will be to make a reality of that. And all things going to plan next year, we'll start work on our new children's hospital. And that will have a huge IT investment in it and will be virtually paperless, and will be the first public hospital in Ireland to be in that space. So I think this is a very exciting time for telecommunications, for mobile technology, and for medicine. And I think what we should try and do is to leverage as much as we can from each other. So on behalf of the Irish Government, I want to warmly congratulate Dr. Tom O'Callaghan and the IHEAD team, the co-organisers, Robert Bollinger of Johns Hopkins, Reza Jaffrey of GETHealth International, and also the ITU. I commend all of the partners for giving their time and commitment to building these important relationships. Finally, I want to wish all our international guests a very productive and enjoyable stay in Ireland. I look forward to receiving updates on the development and progress of this remarkable partnership, and it gives me a great pleasure to formally declare this conference open. Thank you very much.
Thank you, Minister, and I can say you have the full support of all of us on the Irish side and on the international side in terms of helping to disrupt the use of technology in driving healthcare delivery, particularly at the community and primary care level. I think your comment about primary care being far more evolved in the use of ICT is very clear. We have about 95% of care delivered in Ireland is delivered in primary care, and about 70 to 80% of all primary care practitioners use e-health records in a consultation by consultation basis. So it's been used very widely here, and it's very advanced. So next on the agenda, I'd like very quickly for us to have a short message from Hamadoun Touré, the General Secretary of the ITU, who unfortunately hasn't been able to join us because his daughter is getting married today. So it's a very big event, and we wish them very well as a family on this occasion. He's presided over the ITU for quite a period of time, and is from Mali originally, so understands very deeply the issues we're discussing today. And his group have been highly supportive to this event, and for that we're very appreciative. So thank you.
Your Excellency Minister Varadkar, ladies and gentlemen, good morning. And let me apologize for not being with you in Dublin in person today. This is my loss. I attended the first GETHealth Summit in New York last year and experienced wonderful Irish hospitality during the Broadband Commission meeting in Dublin in March. So I know what I'm missing out. Knowing your host IHEAD and the Johns Hopkins Center, I know that you are engaged in very important work on global health education and technology for training health workers via digital media and ICTs. This is more important now than ever before, because with globalization, the world is ever more interconnected. The Ebola epidemic highlights how interdependent we all are for our health and well-being. I am firmly convinced about the transformational power of ICTs in combating epidemics and helping relief efforts in response to crisis. This is why we convened a special session on Ebola at PP14, the ITU's Plenipotentiary Conference, which concluded just last week in Busan, Korea. The session was very well attended, with expressions of support from governments, individuals, and organizations. And I am pleased to say that the results were obvious and immediate, because last week, ITU member states endorsed a resolution on Ebola. At the same time, ITU partnered with GSMA and ISOC to launch a joint initiative to combat Ebola by increasing the use of and effectiveness of ICTs for better preparedness, early warning, and response. But our work does not, of course, stop here. We need a far-sighted, holistic approach to health, taking into account prevention, awareness, effective nutrition, hygiene, trained staff, and basic facilities to combat the myriad threats to populations at risk, and especially children. And that is where you come in, working to raise health awareness and to provide trained health staff for even the most challenging of situations, and making full use of the power of ICTs and remote telemedicine to achieve this. Let me close by applauding your efforts. Your work is more urgent than ever, and let me wish you all success during this summit. Thank you.